One of the nicer things you can say about Donald Trump is that he's a massive bully. And in order to stand up to bullies and anyone who is against health coverage for all of these people and Medicaid, we need somebody to fight, and we need somebody to stand up to these bullies. And we are so grateful to have our next speaker fighting for us every day. Her voice has resonated through the halls of Congress for 2 decades, and we are a better country because of her. She was one of the most important figures in getting the Affordable Care Act to pass, and has been a longtime fighter for health care for all Americans. Ladies and gentlemen, U.S. House Democratic Leader Nancy Pelosi.
Thank you, Justin, for having such an important grasp on what is at stake and presiding here today. Let's hear it for Justin. My purpose here this evening is to say thank you on behalf of all those in Congress who are fighting for good health for our country, health care and good health. To the Democrats in the Senate, the Democrats in the House, the Republicans in the Senate who voted with us. I also want to thank each and every one of you. That is my main purpose. To thank Ben and Move On, and to thank the Hub Project for bringing people together all over the country. When this event was planned, and we were talking about it earlier in the week, we had hoped that it would be a celebration. We had hoped that it would be. And the reason it is because of all of you. The reason it is because of the voices that we heard here this morning. Andrea and her beautiful story. And by the way, Andrea, you're riding the buses because we passed the Americans with Disability Act. It had its anniversary just a couple of days ago. And that was bipartisan. And to Jeff, to hear his story about his personal struggle, Ali telling Ethan's story so generously, and Halika telling her story, Dr. Rao telling the story of her experiences, Rachel telling Leo's story. So Leo, when he spoke and he came down, I said, Leo for president. And Leo said, no, I want to be Spider-Man. Didn't I know? Ola and her wonderful story, and I appreciate her nod to the Americans with Disabilities Act as well. Steve telling Anthony's story with Zach there and Laura, thank you for sharing your beautiful story. And not only that, speaking so forcefully about what we need to do to keep this going. And Natalie talking to us about Sophia. Oh my goodness. Oh my goodness. And as she said, all of these people speaking about their families are speaking about families across the country. Just a few days ago, well, the night of the vote, we were all on the lawn outside of the Capitol, and the stars of the show were the little lobbyists. Some of them are here this evening. The little lobbyists. There they go. They were so great. They were so absolutely great. And even then, we weren't absolutely sure. But here we are now, hearing the stories, understanding the challenge, wondering why. Why is it hard for some in this town to understand the value of good health and what it means not only to the health security, but the financial security of families to have the renewal and the improvement of the Affordable Care Act instead of the repeal? Why don't they understand that? And why does the president say he's going to starve it, he's not going to put the funds, which the law calls for? The law calls for the president releasing the funds for all of this. I'll tell you this, when the Republicans passed some Medicare Part D, that's a good program, but it was a real giveaway to the pharmaceutical industry, increased the deficit enormously, so we said we can do better than this. But their side of the aisle had the majority, they won. We didn't like the way it was put together, but we never stood in the way of our constituents availing themselves of it. And In fact, we helped with the outreach so the constituents could get the advantage, even though we, again, did not like the construct of it. So these people should understand this is the law. The Affordable Care Act is the law. And the funds that need to be there, the president has the power to release or withhold. So where do we go from here? What we need to do is to make sure he does not sabotage the Affordable Care Act. We need them to put forth the funds. We need them to do the outreach. We need them to once again renew what we had in the bill, the reinsurance, which will help. There's some things that even Senator McConnell had in one of his bills. We didn't like his bill, but he understood that even for one of their bills to prevail, they needed to have that funding if they were going to wait 2 more years to repeal and delay. And so it's easy. They just have to do it. They want to live to fight another day, we'll be fighting there with them. And let me just thank you for another thing, because Ben and I were speaking. It hasn't Move On just done a spectacular job. And Hub Project, let's thank Hub Project for bringing so many groups together. Our lives on the line. But we were talking that about 4 days after the election, we all got on the phone together, the social media groups, Move On, so many others. We got on the phone and understood one thing. Whatever other disagreements we might have or enthusiasms we may not share or do share, one thing was certain: we had to protect our care. And so right then and there, people saw the urgency and said, what can we do? And that was that was Sunday after the election was Tuesday. Was that 4 or 5 days? And since that time, people all over the country have weighed in. When the march came, and Ben asked how many people were in the march, how many people were in the march? Let's hear it again. People saw their power. At the march, they saw their power. They knew the power of their voices, their presence. March for many reasons. One was to protect our care. And so knowing and seeing the strength of their own actions, they participated, many of you, to hear, and many millions more people in terms of town hall meetings and sit-ins in offices and calling into the offices of Republican members of Congress, House and Senate, to tell your personal story. Those stories are so inspirational, so eloquent. And by the way, nothing is more eloquent to a member of Congress than the voice of his or her own constituents. So that's why it's important for my constituents not to necessarily call me to say thank you, but to call their friends who live in Republican districts to call their elected officials. But right now, in addition to doing that, because you don't know what they might come up with next, I think it's important for us in Congress to say thank you to you, and for many of you in Congress to say thank you to those who voted right. While we sing the praises of Senators Collins, Murkowski, and McCain, and weren't they wonderful, it's important to note that 100% of the Democrats, House and Senate, are there, and that for some of those members, this was as difficult to vote as it was for Senator Murkowski, Senator Collins, and Senator McCain. So you can take a day to say thanks, but get right back on the line to the Republicans. Because this should not be partisan. Why should the good health of our country be partisan? Why? Why would they put a bill like this forward? Well, why? Because their health care bills are not health care bills. They are tax cut bills for the rich. And that is the problem with what we do not have in terms of shared values. But know your power, the power that you have to make a difference. Take pride in what you have done take pride in the fact that after the other night, when that vote went the way it did, people lost some of the fear that they had. Fear. They had lost some of the fear, and that's a horrible thing, to have fear about the health of your child or yourself. And as has been said by a number of our speakers, including, all of them practically, pre-existing medical conditions are rampant in our country. Over 125 million people. Any one of us is one diagnosis, one accident away from having a pre-existing medical condition for life. So we're very proud of Affordable Care Act, and I want to make a nod to the staff, the congressional staff, who made all of it possible in the first place. Wendell Primus of my staff, with so many others, worked relentlessly to create the Affordable Care Act, working with members, working with all of you, but also working to save it this past week. Let's just go back a little bit, because I said about then and move on that Sunday after the election, and then all of the actions taken, and then the march and how that exploded, the activism. Understand this, whatever the staff did, whatever the members did, that inside maneuvering is important. But without your outside mobilization to amplify all of that, we would not have had the success. It's all attributed to you, to the social media groups, to the individuals telling their stories. I'll just tell you this story. When we first were passing the Affordable Care Act, it was some setbacks here and there, and the press said to me, what are you going to do? It doesn't appear that you can do this now that you've lost Senator Kennedy's seat in Massachusetts. And I said, we view this as an opportunity and a responsibility of a generation. There with Social Security, Medicare, and Medicaid. And we are not going to let anything stand in the way of our passing this legislation. If there's an obstacle, a fence in our way, we'll push through the gate. If the gate doesn't open, we'll climb the fence. If the fence is too high, we'll pole vault in. If that doesn't work, we'll parachute in. But we're not letting anything stand in the way of that. So after it was over, they said, which one did you do? We said, you know what? We pushed open the gate. And we know how we were able to do that, not just with the members of Congress, but with so many of you, with the nuns and so many of you who were there, healthcare providers, community activists, just pushing open that gate. We're not letting them push that gate back. And I want to thank you for one more thing. One more thing. One of the benefits of this fight has been the recognition of how important Medicaid is in the lives of the American people. Going into the debate, people said, well, you know, people think it's just for poor people. Well, that would be justification enough. But there is a recognition now. I see the veteran sign here. 1.75 million veterans are on Medicaid. Thank you to our veterans. Around 60% of the funds for long-term health care for our seniors are paid for by Medicaid. These are middle-income seniors in nursing homes or getting care at home, attention at home. And for our children, even with families that have health insurance from their employer. I've met so many families around the country that say, we work, we have health and private insurance, but it only goes so far when you have a fragile child and you have children who need the kind of help that Sophia was talking about, Sophia's mom, Natalie, was talking about earlier. So let us understand a couple things. One is, what came out of this is our unity around the idea that health care is a right for all, not a privilege just for the few. Secondly, that Medicaid is important to every family in America, whether they know it yet or not. And we've got to support that. And third, that now we have to improve and update the Affordable Care Act, we want to do so in a bipartisan way. That can only happen with your continued involvement. So let's appreciate those who voted right. When I say right, not only correctly, but did the right thing for the American people. Let's appreciate them. Let's thank them. But let's keep the heat on for the others that we need to draw over. But most of all, take pride in what you have done. What you have done to save lives, to save a pillar of economic and health security like Medicare and Medicaid are, so too the Affordable Care Act. Thank you, Move On. Thank all of you. Thank you, Hub. And let us thank everyone who is here. Carolyn and Leah and Bea now are going to entertain us. Let's say, Ben Winkler, you're amazing. Let's hear it for Ben Winkler. Thank you all very much.